A cat sitting perfectly still in a tight, hunched position on the living room floor often looks like a harmless loaf, a pose we've come to associate with comfort and relaxation. To most owners, this is just another cute quirk of feline behavior, a sign that their companion is winding down for a nap. But for a creature that evolved as both a solitary predator and a vulnerable prey animal, this specific type of stillness is frequently a mask. In the wild, showing any sign of physical struggle, a limp, a whimper, or a visible wound, is an invitation for a larger predator to strike or for a rival to move in on their territory. This evolutionary hardwiring didn't disappear when cats moved into our living rooms. It simply became more sophisticated. While we might expect a cat in pain to cry out or limp, the reality is far more subtle. Most owners think their cat will tell them when something is wrong through vocalization. But by the time a cat is actually meowing in pain, the situation is often critical. Instead, they communicate through a series of silent shifts in their daily routine, body language, and even their facial expressions. Understanding these shifts isn't just about being a proactive pet parent. It's about honoring the deep bond of trust you've built. Your cat is counting on you to see through the mask they are evolutionarily programmed to wear. Before we look at the first sign, consider that your cat sees you as their primary protector, and their silence isn't a lack of communication. It's a plea for you to look closer at the things most people miss. 1. The rigid hunch and the tucked head. There is a significant difference between a cat who is loafing because they are cozy and a cat who is loafing because they are guarding their body. When a cat is truly relaxed, their muscles are soft, their tail is loosely wrapped or tucked, and their head is often resting or held at a natural, easy angle. However, one of the primary hidden signs of internal pain, specifically abdominal or organ-related discomfort, is the rigid hunch. In this scenario, you'll notice your cat sitting with their back arched higher than usual, their paws tucked tightly under their chest, and their head lowered toward the floor. Their nose might be pointing down at their paws rather than looking around the room. This is a protective, guarding posture. By tightening the abdominal muscles and lowering the head, the cat is physically bracing themselves against internal pressure or sharp discomfort. It's similar to how a human might curl into a fetal position during a bad stomach cramp. Research into feline ergonomics suggests that this posture helps take the weight off certain internal structures. If you notice your cat staying in this position for hours, or if they seem stiff when they finally do move, they aren't just being lazy. They are likely dealing with anything from gastrointestinal distress to kidney issues. The takeaway for you is to observe the tension in the loaf. A relaxed cat is fluid. A cat in pain is static and brittle. 2. The over-grooming fixation. We often associate grooming with cleanliness and health, but it is also a cat's primary tool for self-soothing. Most owners assume that if a cat is licking themselves, they are simply being fastidious. However, when a cat focuses on one specific area, such as a single joint, the base of the tail, or a patch on their belly, to the point of thinning the fur or creating a bald spot, it is often a sign of referred pain. In feline physiology, cats will frequently lick the skin directly above a site of internal inflammation. If a cat has arthritis in their hip, they may not limp initially. Instead, they will spend hours obsessively licking that hip. The act of grooming releases endorphins in the feline brain, which acts as a natural, albeit temporary, painkiller. They are essentially trying to rub the pain away from the inside out. Evolutionarily, grooming also masks the scent of blood or infection from predators. Another reason they double down on it when they feel vulnerable. If you see a lick line or a patch of fur that looks wet or thinned out, don't just reach for an anti-itch cream. Consider that the source of the trouble might be deep beneath the surface, in the joints or the lining of the bladder. This isn't just a habit, it's a localized distress signal. 3. The deceptive healing, purring. As the most common misconception in the world of cat ownership, a purring cat is a happy cat. While purring is certainly a sign of contentment, it is also a powerful survival mechanism used during times of extreme physical trauma. Veterinary professionals have long documented cats purring while they are in labor, after being hit by a car, or even when they are nearing the end of their lives. Scientific studies have revealed that the frequency of a cat's purr, between 25 and 150 Hz, actually helps improve bone density and promotes the healing of tendons and muscles. It is a low-frequency, internal massage system. When a cat is in pain, they will often purr to self-regulate their nervous system and manage their heart rate. The key to distinguishing a happy purr from a pain purr lies in the accompanying body language. A happy purr comes with kneading, making biscuits, half-closed, soft eyes, and a relaxed tail. A pain purr is often accompanied by the rigid hunch mentioned earlier, or squinted eyes that don't quite close. If your cat is purring but refuses to move or eat, that sound isn't an expression of joy. It's a biological effort to heal themselves. Understanding this paradox allows you to provide the help they are trying to give themselves. 4. The feline grimace scale. Until recently, we didn't have a standardized way to measure pain in a cat's face. But researchers at the University of Montreal developed what is now known as the feline grimace scale. Most owners miss these facial cues because they are incredibly subtle. They think a cat's face is stoic, but the reality is that pain changes the very structure of their features. When a cat is in pain, look at 3 specific areas: the ears, the eyes, and the muzzle. In a healthy, comfortable cat, the ears are forward, facing, and upright. In a cat experiencing discomfort, the ears will begin to rotate outward and flatten slightly toward the sides of the head. Their eyes, instead of being round and bright, will become orbitalized, meaning they squint and the eyelids appear heavy or tense. Finally, the muzzle area, where the whiskers are, will appear tense or bunched up, and the whiskers themselves may lose their natural curve and point straight down or bunch together. This facial tension is a direct result of the sympathetic nervous system reacting to a pain stimulus. It as the feline version of a clenched jaw. Before you move on with your day, take a moment to look at your cat's face in a neutral setting. If they look worried or tense, even when nothing is happening, their body is likely fighting an internal battle. 5. The litter box rebellion. One of the most frustrating experiences for a cat owner is when a previously well-trained cat starts urinating or defecating outside the litter box. The common reaction is to assume the cat is acting out or being spiteful because of a change in the house. However, cats do not possess the cognitive desire for revenge. In almost every case, a litter box lapse is a sign of physical pain. For older cats, the high sides of a traditional litter box can be agonizing to climb over due to undiagnosed arthritis in the hind legs. They associate the box with the sharp pain of entry, so they find a flatter surface, like your rug or your bed, to relieve themselves. In other cases, such as a urinary tract infection, UTI, or cystitis, the cat associates the act of urinating in the box with a burning sensation of the infection. They think, every time I go in that blue box, it hurts, so I'll try the laundry basket instead. That mistake on the floor isn't a behavioral problem. It's a diagnostic clue. Instead of frustration, look for patterns. Is the box too high? Is the cat straining? This is their way of showing you that a basic biological function has become a source of fear or physical distress. 6. Social withdrawal and the hiding instinct. Every cat has a favorite hiding spot. But there is a clear distinction between a cat who is napping in a closet and a cat who is withdrawing from the world. Their instinct tells them to find a dark, enclosed, and inaccessible space where they can stay until they either recover or pass away. This prevents them from drawing the attention of predators. If your usually social cat, the one who meets you at the door or follows you into the kitchen, suddenly spends the entire day under the bed or behind the sofa, this is especially true if they refuse to come out for high-value treats or their favorite toy. This withdrawal is often accompanied by a lack of interest in their surroundings. They aren't just sleeping, they are hunkering down. Think about your cat's baseline personality. A sudden shift from social butterfly to hermit is one of the most reliable indicators of systemic pain or illness. They aren't being moody. They are following an ancient script that tells them the safest place for a broken body is in the shadows. 7. The mouth sensitivity and change in appetite. Dental pain is one of the most common, yet most frequently overlooked sources of chronic suffering in cats. Because cats are obligate carnivores, their drive to eat is incredibly strong. Most owners think, if they're still eating, they must be fine. But a cat will often continue to eat even with rotting teeth or inflamed gums because the alternative is starvation. The hidden signs of dental pain are subtle. You might see your cat pawing at their mouth after eating, or they might tilt their head to one side to chew on only one side of their jaw. You might notice them dropping pieces of kibble or suddenly preferring wet food over the dry food they used to love. In some cases, they may approach the food bowl with interest, take one bite, and then hiss or run away because the contact with the food caused a sharp jolt of nerve pain. This isn't just picky eating. It's a sign of significant oral trauma. Periodontal disease can lead to heart and kidney issues as bacteria enters the bloodstream. By the time their breath smells foul or their gums are bleeding, they have likely been suffering in silence for months. Paying attention to how they eat is just as important as what they eat. The bond we share with our cats is built on a language that doesn't use words. Because they are so skilled at hiding their discomfort, it is our responsibility to be their advocates, their observers, and their voice. When you notice these 7 signs, you aren't just noticing a change. You are breaking through an evolutionary wall that your cat has built for their own protection. Remember, a cat who is slowing down isn't always just getting old. They are often just getting sore. By catching these signs early, you can transform a life of silent suffering into one of comfort and longevity. Your cat may never be able to tell you where it hurts, but if you look closely enough, they are showing you every single day. If this helped you understand your feline friend a little better, consider sharing this with another cat owner. You might just help a silent sufferer get the relief they need.